right now, every single day, your body is likely producing a handful of mutated, potentially cancerous cells.
Which is a pretty terrifying thought, honestly.
It really is. But I mean, under normal circumstances, your immune system kind of acts like a microscopic bouncer at a club.
Right, yeah.
It spots the troublemakers, grabs them by the collar, and just throws them out before they can cause any real damage.
Exactly.
But what happens when a cellular mutation is born in a place so deep, so cavernous, and so inherently quiet that the bouncer never even notices it's there?
Well, that's the danger.
Right. Like what happens when the danger doesn't announce itself until it has already, taken over the entire building?
You basically end up with a biological ambush.
Yeah.
And in the landscape of women's health, that ambush has a very specific, very devastating profile.
Welcome to the Funeral Channel Network, everyone. Today's deep dive focuses on a deeply impactful intersection of healthcare, advocacy, and memorialization.
Yeah, we are looking at a topic that touches just, well, countless lives, and yet it often exists entirely in the shadows until it is fundamentally too late.
We're talking about the Teal Ribbon, specifically its vital role in ovarian cancer awareness, early recognition, and legacy.
It is such a profound topic, and our sources today, they provide this incredibly comprehensive look at the realities of ovarian cancer.
They really do. We're pulling heavily from the Teal Ribbon, Advocacy and Awareness for Ovarian Cancer, alongside insights into the specific memorialization efforts supported by organizations like the Funeral Program site.
So we are diving into the medical facts, the biological mechanics of the disease,
Yeah.
and the complex social frameworks surrounding women's healthcare.
And the mission of our deep dive today is multi-layered. We are going to unpack why ovarian cancer has earned the terrifying moniker of the silent killer.
Right.
We want to explore how the Teal Ribbon transforms subtle everyday symptoms into a very loud, urgent call for action.
Which is so crucial.
And finally, we are going to look at how personalized memorialization bridges this massive gap between honoring a profound loss and fighting fiercely for a future cure.
Okay, let's unpack this, because the knowledge we are about to discuss today is quite literally life-saving, and we have a lot of ground to cover.
We really do. And, well, we need to establish the reality of the battlefield right away.
Yeah, set the stage for us.
This isn't just about the clinical reality of a disease, like reading statistics off a chart. It is about how society, medicine, and memory all intersect. It's about how we communicate pain,
Right.
how we advocate for ourselves in systems that often just don't listen, and how we remember those we've lost in a way that actively protects the living.
Protecting the living. I really want to hold on to that phrase.
This is a powerful idea.
Because before we can truly understand what the Teal Ribbon is advocating for,
Yeah.
we really have to understand what it is fighting against.
Exactly.
We have to look at the biological reality of this disease, the actual anatomy of the silent killer. What's fascinating here is the sheer geographical reality of the female pelvic region.
Okay, break that down for us.
So ovarian cancer begins in the ovaries, right? Which are these small, almond-sized organs responsible for producing eggs and hormones like estrogen and progesterone.
Right, the basics we all kind of learn in biology class.
Exactly. But the disease doesn't just stop there, or even necessarily start exclusively in the ovarian tissue itself.
Wait, really? It doesn't always start in the ovary?
No, it frequently originates in nearby tissues, specifically the fallopian tubes or the peritoneum.
The peritoneum being, what exactly is that? Let's paint a picture for the listener.
Sure. Think of the peritoneum as the biological wallpaper of the abdominal cavity.
Okay, wallpaper.
Yeah, it is a continuous membrane that lines the inside of your abdomen, and then it folds over to cover your internal organs.
So it's kind of wrapping everything up in there.
Right. It's a vast, expansive surface area. And this internal geography is exactly why it earns that silent killer moniker.
Because there's so much space.
Precisely. In its early stages, a tumor growing on an ovary or inside a fallopian tube or along that peritoneal wallpaper, it presents with minimal or absolutely zero noticeable symptoms.
Zero symptoms. I mean, that is just terrifying to think about.
It's the definition of insidious.
It's like having a home security system that is fundamentally flawed.
How do you mean?
Well, imagine you spend thousands of dollars on a state-of-the-art alarm system for your house. You expect it to detect the very first wisp of smoke, right?
Right, of course.
To give you time to grab your family, get out, or maybe grab a fire extinguisher while the flame is still manageable.
You expect the alarm to sound at the point of origin.
Exactly. But with ovarian cancer, the security system is wired completely backward.
Yeah.
It completely ignores the smoke in the kitchen. It ignores the small grease fire on the stove.
It just lets it burn.
Right. It only triggers the blaring, unavoidable alarm when the fire is already raging in the living room, the staircase is blocked, and the roof is actively caving in. Why is it so difficult to detect early on compared to other diseases?
To build on your analogy, the reason the smoke detector fails in the early stages is because of the physical space the fire has to grow in.
The actual literal space inside the body.
Yes. If we look at breast cancer or skin cancer, those occur in dense, relatively accessible tissues.
Right, you can feel them.
Exactly. A lump in the breast can often be felt during a routine exam or a self-check in the shower. A melanoma on the skin can be seen in the mirror when you're getting ready.
They're on the surface or near it.
But the ovaries and the fallopian tubes are located deep within the pelvic cavity.
They are basically suspended in a void.
Essentially, yes. The pelvic cavity is surprisingly spacious.
Like, how spacious are we talking?
There is physical room for a tumor to grow to the size of a grapefruit, or even a small melon, without immediately pressing against a vital organ.
Oh my God, a melon.
Yes, it can grow that large without compressing a major nerve or causing any visible external change to the body. The cancer is afforded the luxury of space and time.
Which brings us to a massive, glaring issue. And I think anyone listening right now is probably wondering the exact same thing.
The screening question.
Yes. Why isn't there a routine scan for this? I mean, we
Yeah.
have mammograms to look inside breast tissue.
You do.
We have colonoscopies to check the intestinal walls. We have pap smears for cervical cancer. So what is the barrier here?
It's incredibly frustrating.
Why is there no reliable, routine screening method for the general population when it comes to ovarian cancer?
It really comes down to cellular accessibility and the limitations of our current imaging technology.
Okay.
A pap smear works beautifully for cervical cancer because a doctor can physically swab the cervix. They can look at those cells under a microscope to catch precancerous changes.
Because it's right there.
Right. You cannot safely or easily swab an ovary. It requires invasive surgery to access.
You can't just go in and take a sample on a Tuesday afternoon.
You really can't. It's a major procedure. And regarding imaging, we do have tools. Transvaginal ultrasounds can show the size and shape of an ovary
Okay, so why not just give everyone an ultrasound every year?
because it's not specific enough. And then there's the CA-125 blood test, which measures a specific protein that's often elevated in ovarian cancer patients.
So we have an ultrasound and a blood test. That sounds like a screening protocol.
It sounds like one, but neither of these is reliable enough for general population screening.
Why not?
Because benign cysts can look exactly like tumors on an ultrasound, and CA-125 levels, they can spike from completely non-cancerous conditions.
Like what kind of conditions?
Things like endometriosis, menstruation, or just pelvic inflammatory disease.
Oh, wow. So everyday things can trigger the test.
Exactly. Routine screening using these tools yields an unacceptably high rate of false positives.
And a false positive means,
It means unnecessary, potentially dangerous surgeries for completely healthy women. You can't justify opening up thousands of healthy women's abdomens just to check if a shadow in an ultrasound is cancer or a normal cyst.
I see. So because the standard medical tools are too blunt or the false positive risk is just too high, there is simply no routine mechanical smoke detector for the general population.
None.
The fire is just left to grow in the dark.
Precisely. And the consequence of that lack of screening is devastating.
I can imagine.
Diagnoses frequently happen at later stages, often after the cancer is already metastasized.
Meaning it's spread.
Yes, spread beyond the ovaries and into the upper abdomen or other organs.
Yeah.
And the survival rates just drop precipitously once the disease escapes that initial localized area.
If you don't know you are sick until the disease has already migrated to other parts of your body, your battle is exponentially harder.
Exponentially.
And this is exactly why the Teal Ribbon campaigns place such a massive emphasis on proactive awareness.
They have to.
If the doctors don't have a reliable machine to scan for the early signs, the Teal Ribbon steps in to say, we have to be our own alarm system.
That is the crux of the entire movement. Because there is no general screening, the entire burden of early detection shifts.
It shifts to the patient.
It falls entirely on the individual patient and their subsequent conversations with their healthcare providers. They have to interpret the body's subtle, everyday whispers before they become screams.
Let's get into those whispers. Let's talk about decoding the subtlety of symptoms, because this is the primary mission of the Teal Awareness Ribbon, symptom education.
Right.
But I have to admit, looking at the core information on these symptoms, I feel a tremendous sense of frustration on behalf of every person out there listening to this.
I completely understand why. The
Oh,
symptoms are notoriously vague.
vague is an understatement. We are talking about bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, and frequent or urgent urination.
Yeah.
And then there are the secondary signs.
Yeah.
Fatigue, back pain, changes in bowel habits. I'm going to push back on this on behalf of you listening right now.
Please do.
Wait. Bloating, fatigue, back pain. Aren't these just the standard baseline physical complaints of existing in the modern world?
They absolutely are.
I mean, we sit at ergonomic nightmare desks all day. Of course, we have back pain.
Right.
We eat a heavy takeout meal or experience normal monthly hormonal fluctuations. We get bloated. We are perpetually stressed, so we are perpetually fatigued.
It's the human condition at this point.
Exactly. So how is a person supposed to know the difference between I had a really long, exhausting week at work and I have a silent killer actively growing inside my pelvic cavity without developing severe hypochondria?
That tension you are feeling is exactly what makes ovarian cancer so insidious. Your frustration is entirely valid.
It just seems impossible to parse out.
It does, because
Okay.
these symptoms mimic incredibly common, less serious conditions: irritable bowel syndrome, minor urinary tract infections, or just general stress and aging.
Right.
But we need to look at the underlying mechanics, the why and how behind these symptoms, to understand how to spot the difference.
Okay, let's unpack the mechanics. Let's make this tangible. Why does a tumor on an ovary make you feel full after eating just 3 bites of a sandwich?
It's due to a condition called ascites.
Ascites. Okay.
When cancer cells spread to the peritoneum, that abdominal wallpaper we talked about earlier,
Mm-hmm.
they irritate the lining.
Okay, they make it inflamed.
Yes. And this irritation causes the lining to weep fluid. It acts like a leaky faucet inside your belly.
A leaky faucet.
Over time, that fluid accumulates in the peritoneal cavity.
So you are literally filling up with fluid internally.
Yes. And that fluid takes up space.
Oh, I see where this is going.
It physically presses against your stomach. So when you go to eat, your stomach cannot expand the way it normally would to accommodate the food.
Because it's being squeezed from the outside.
Exactly. You feel prematurely full, or you experience significant difficulty eating because your stomach is being externally compressed by this buildup of ascites.
That makes so much sense. It's a physical space issue, and I assume that exact same fluid buildup is what causes the profound bloating.
Exactly. The bloating isn't just gas from eating something disagreeable. It is physical distension from fluid and tumor growth.
It's actual volume being added to the abdomen.
Yes. And what about the frequent urination?
Right. Why does that happen?
That happens when a pelvic mass grows large enough to physically press against the bladder, reducing its capacity.
So your bladder literally can't hold as much liquid because a tumor is squishing it.
Right. And the back pain and pelvic pain, that occurs when the tumor mass begins to compress the complex network of nerves running through the pelvic floor and lower spine.
See, understanding the mechanism changes everything for me.
It reframes it entirely.
It's not just I feel bloated, it's my internal organs are being compressed.
Yes.
But even knowing that, the symptoms are still subtle in the early stages. The leaky faucet starts slow. So how do we avoid rushing to the emergency room every single time we need to pee twice in an hour or feel a little tired?
The defining metric, the absolute golden rule of the Teal Ribbon campaign, is the timeline.
The timeline.
It is all about the pattern and the persistence.
Yeah.
The critical red flag is if these symptoms persist for more than a few weeks.
More than a few weeks.
That is the line in the sand. It is not about an isolated incident of feeling full after a heavy dinner or having 3 days of bloating around your menstrual cycle. It is the unbroken persistence.
So it's the everyday nature of it.
If you are experiencing pelvic pain, or you are suddenly getting full very quickly every time you eat, and this continues day after day, week after week, without resolving, well, that is no longer an everyday complaint. That is a systemic pattern.
It requires an intense level of self-vigilance. You have to really know your body's baseline to recognize when that baseline has permanently shifted.
You do. You have to track these subtle but significant signs, maybe even write them down.
Keep a log.
Yes. And once you recognize the pattern, it requires a collaborative effort to do something about it. The patient has to bring these persistent patterns out of the dark.
They have to speak up.
And crucially, the healthcare provider must be willing to take them seriously, rather than dismissing them.
And that brings up a massive systemic issue. Because imagine doing everything right. Imagine you, the listener, track your symptoms. You notice the bloating and the back pain have persisted for 21 days straight.
You've got your data.
You make the appointment, you go to the doctor, and the doctor barely looks up from their tablet and says, it's probably just indigestion. Take some over-the-counter antacids, try to reduce your stress, and get some rest.
Which is a scenario that plays out in clinics every single day.
It's infuriating.
It is. The vague nature of the symptoms provides medical professionals with an easy, highly plausible out if they are not specifically educated or vigilant about the realities of ovarian cancer.
It's medical gaslighting, whether intentional or not.
It functions as gaslighting, yes.
The doctor hears bloating and fatigue and immediately files it under routine female complaints instead of investigating the persistence of the pattern.
This is precisely why the Teal Ribbon represents more than just biological awareness. It symbolizes a massive commitment to women's health advocacy.
It's a call to action.
It is about empowering patients to say, no, this is not my normal. I need a pelvic exam. I need an ultrasound. I want a second opinion.
But stepping into a doctor's office and demanding a second opinion from an authority figure, that is a terrifying prospect for a lot of people.
Oh, absolutely. It goes against everything we're taught about medical authority.
And it brings us directly to the broader systemic barriers that the Teal Ribbon movement is trying to tear down.
Because recognizing a persistent symptom is only the very first step. Actually getting that symptom investigated brings us to the intersection of healthcare and sociology.
So, what does this all mean in practice? Let's talk about these barriers. The sources highlight that cultural, social, and economic factors heavily influence a woman's access to medical care and her baseline awareness.
They are massive determinants of health outcomes.
Let me try to translate this abstract concept of systemic barriers into a real-world analogy for you listening.
Please do.
Let's view getting a proper medical diagnosis as a road trip. If you are a wealthy, well-connected person with excellent corporate health insurance, you are driving on a freshly paved, multi-lane medical freeway.
Smooth sailing.
You notice a symptom, you call your concierge doctor, you get a scan the next day, and you have your answers. You pay the toll, and you keep moving.
The path of least resistance.
Exactly. But if you are marginalized, if you are dealing with economic hardship, lack of insurance, or linguistic barriers, you are not on the freeway.
No, you're not.
You are on a dirt road full of potholes and broken bridges. Having the symptom is just the start of the nightmare.
It's just the first hurdle.
Right. Do you have the paid time off from work to even go to the clinic between your two jobs?
Often, no.
Do you have the economic means to cover a massive copay for a diagnostic ultrasound that your insurance might deny because your initial symptoms were just bloating?
And beyond the economics, there is the cultural barrier.
Right. Do you come from a cultural background where discussing reproductive organs, menstruation, or pelvic pain is considered strictly taboo?
That's a huge factor in many communities.
Because if you do, the societal pressure to suffer in silence rather than seek help is immense.
The silent killer thrives in the dark, and successful barriers are what keep the lights turned off.
That's a chilling way to put it.
If we connect this to the bigger picture, the Teal Ribbon isn't just a piece of fabric pinned to a lapel. It is a social unifier. It is an infrastructure project designed to build bridges over those dirt roads.
How does it do that, like, functionally?
Through aggressive community outreach, targeted educational campaigns, and free support groups.
Getting the word out.
The advocacy movement actively attempts to level the playing field so that all women, regardless of their zip code, income bracket, or cultural background, have access to the vocabulary and the resources they need.
The vocabulary is key, right? Knowing how to describe the pain.
Yes. It teaches women how to track their symptoms effectively so they can present undeniable data to their doctors. It provides resources on how to navigate insurance denials. It gives them the permission to trust their instincts.
It gives them the armor they need to fight for their own lives.
Exactly.
But fighting through those systemic barriers just to get someone to look at an ultrasound, I mean, it's exhausting.
It depletes you before the real fight even begins.
And if that ultrasound confirms the worst, if the diagnosis is ovarian cancer, the battle hasn't even really started. It just shifts to a new, infinitely more terrifying front.
It initiates the emotional and physical journey of survivorship, which is a massive component of our source material.
The emotional toll of this diagnosis is staggering. We are talking about intense fear, crushing anxiety, and a profound sense of isolation.
It's world-shattering.
You have just been told you have a disease that has likely been growing inside you undetected for months or even years. Your trust in your own body is totally shattered. And this is where the teal ribbon completely shifts its function.
It transitions from a diagnostic warning system to an anchor of community support.
Here's where it gets really interesting to me. The teal ribbon operates with this incredible dual nature. On one hand, it is a stark warning label. It's a neon sign pointing at a threat for the general public. But simultaneously, for the person who has just received that terrifying diagnosis, it acts like a beacon,
A signal fire.
a flare shot up in the dark, signaling across the battlefield, you are not alone in this.
And that psychological component is absolutely inseparable from the physical fight against the disease.
Because the mind and body are connected.
Exactly. The sheer logistics of oncology treatments navigating the medical system as a confirmed cancer patient require a level of endurance that is almost impossible to generate in total isolation.
Let's talk about those logistics, because getting treatment sounds so clean and clinical, but the reality is incredibly messy.
The practical needs are overwhelming. Oncology treatments for ovarian cancer often involve extensive major surgeries.
Right, to remove the tumors.
Removing the reproductive organs, sometimes the spleen, part of the colon, scraping that peritoneal wallpaper we talked about.
Good Lord.
And that's often followed by grueling rounds of chemotherapy. We are talking about managing severe side effects, profound nausea, neuropathy, hair loss, and utter physical exhaustion.
And while your body is going through a literal war zone, the rest of your life doesn't just pause.
Exactly. You still have to organize transportation to daily or weekly infusions.
You still have to buy groceries.
You still have to battle with insurance adjusters over the phone while you are too weak to even stand up. You have to figure out who's going to pick your kids up from school or how you are going to pay your mortgage when you can no longer work.
You need an absolute village.
You need a highly organized, deeply empathetic village. Family, friends, dedicated healthcare teams, oncology counselors, and nonprofit organizations.
Which is where the ribbon community comes in.
And this is why the shared narratives of survivorship are so critical. When a newly diagnosed patient connects with a survivor, often facilitated by these teal ribbon community events, walks, and support groups, they aren't just looking for a heartwarming story.
What are they looking for?
They are gathering vital, pragmatic data.
They are looking for a map through the minefield.
Yes. They're learning how someone else navigated the exact same terror, the exact same surgical recoveries, and the exact same bureaucratic nightmares.
It's tactical advice.
The veteran survivor hands the newly diagnosed patient a roadmap. This fosters a resilience that directly impacts physical outcomes. Hope in an oncology ward is not just a feeling. It is the fuel that keeps patients compliant with punishing treatment protocols when they just want to give up.
The ribbon connects the veteran to the newly drafted soldier. It takes an isolating, inherently terrifying individual experience and transforms it into collective action.
It builds an army.
But, and this is the hard pivot we have to make, because it is the reality of the disease survivorship isn't the only outcome.
No. Given the late-stage diagnoses we discussed earlier, the mortality rates are tragically high. Many families face profound loss.
And the question then becomes, how does a community process that immense world-shattering grief while still maintaining the fierce outward-facing advocacy required to fight the disease?
That's a delicate balance.
How do you keep fighting the fire when the house has already burned down? This brings us to a core focus of the Funeral Channel Network and a deeply moving aspect of the Teal Ribbon's evolution, the profound power of memorialization.
This is where the symbolism of the teal ribbon deepens exponentially. It transcends the individual fight and becomes an enduring symbol of legacy.
For families who have lost loved ones to the silent killer, the teal ribbon transforms into a tangible piece of remembrance. And I want to highlight the work of the funeral program site here because they are a major resource in this specific space.
They do incredible work.
They offer an incredibly large selection of ready-to-wear, customizable ovarian cancer ribbons.
The customization is the critical element. These aren't just generic awareness ribbons.
Right.
They can be personalized with names, birth dates, dates of passing, and heartfelt messages.
Which is an incredible concept to unpack. We are talking about a small, looped piece of teal fabric. But the moment you add a name, the moment you print a specific human identity onto it in gold or white lettering, it shifts entirely.
It changes its entire meaning.
It is used in memorial services, distributed at celebrations of life, and worn on lapels during daily routines long after the funeral is over. It takes a general societal call for awareness and turns it into a deeply intimate, individual expression of honor.
It is the ultimate form of weaponizing grief.
Weaponizing grief, that is a brilliant way to put it. You are taking the heaviest, most paralyzing emotion a human can feel and forging it into a tool to fight the very disease that caused the pain.
When you personalize a ribbon, you are actively manipulating the public perception of the disease. Let's look at how the human brain processes information.
Okay, let's look at it.
When we hear the phrase silent killer on the news, or we read a statistic that thousands of women die from ovarian cancer every year, our brains process that as abstract data.
It's just math.
It is tragic, but it is distant. It happens to other people.
Right. It's just numbers on a sterile chart. You feel bad for a second and then change the channel.
But when you attend a memorial service, or you are standing in line at a grocery store and you see the person in front of you wearing a teal ribbon that says, "In loving memory of Sarah," with her dates of life and death suddenly, the statistic is shattered.
It becomes real.
The abstract data has a name. It has a timeline. It has a grieving family member standing right in front of you, holding a carton of milk.
It forces you to confront the true, devastating human cost of the disease.
Exactly. It makes the invisible silent killer visible and loud. By making the ribbon personal, families guarantee that their loved one isn't just recorded as a casualty of a silent disease.
They become a crusader.
They become a loud, ongoing, unavoidable voice in the campaign for early detection. The act of remembrance itself becomes a highly effective tool for public health.
You are literally wearing their legacy on your chest. And that legacy is shouting the warning that they perhaps didn't get in time. It's a fierce, beautiful way to honor someone. And that exact legacy, that awareness carried forward by families, funded by memorial walks, and sparked by customized ribbons from resources like the funeral program site, directly fuels the next phase of our discussion.
The scientific front.
Because all of this noise, all of this public outcry is what drives the scientific push for a cure.
It drives the research, the clinical trials, and the development of new treatments. The advocacy literally funds the science.
Let's talk about that science. Where do we stand and where are we going? We know the screening isn't there yet.
Sadly, no.
But what about the treatments for those who are diagnosed? The sources indicate that research advances are yielding new therapies, specifically highlighting targeted treatments and immunotherapy.
Yes, these are the game changers.
How do these differ from the standard chemotherapy we always hear about?
This is where the medical advancements get truly fascinating. Traditional chemotherapy is often described as a blunt force instrument.
Like a sledgehammer.
Exactly. It is designed to kill rapidly dividing cells. The problem is, it doesn't just target cancer cells.
Right, because other cells divide rapidly too.
It targets any rapidly dividing cell in the body, which includes hair follicles, the lining of the digestive tract, and bone marrow.
Ah, which explains the side effects.
That is why the side effects, hair loss, extreme nausea, weakened immune systems are so severe.
It's carpet bombing the body to kill the enemy. You destroy the infrastructure while trying to hit the target.
Exactly. But targeted treatments and immunotherapy represent a shift from carpet bombing to using a highly precise sniper rifle.
Okay, a sniper rifle. Walk me through that.
Targeted therapies analyze the specific genetic mutations of a patient's tumor. If the tumor has a specific vulnerability, like a faulty DNA repair mechanism, for instance, the drug targets only that specific vulnerability.
So it ignores the healthy cells.
Mostly, yes. It causes the cancer cells to die, while largely sparing the healthy cells like the hair follicles and the stomach lining.
That is incredible. And immunotherapy, how does that work?
Immunotherapy is even more remarkable. Cancer cells are incredibly deceptive. They essentially wear a biological invisibility cloak.
An invisibility cloak?
Yeah, they send signals that tell the body's immune system, nothing to see here, I'm just a normal, healthy cell, move along.
So the bouncer just lets them stay in the club?
The bouncer doesn't even see them. But immunotherapy drugs work by ripping that invisibility cloak off.
They expose them.
They train the patient's own immune system, that microscopic bouncer we talked about at the beginning, to finally recognize the cancer cells as foreign invaders and attack them naturally.
That sounds like science fiction. It's incredible. And the sources note that clinical trials are the gateway for patients to access these innovative therapies, which simultaneously broadens our understanding of how the disease mutates and adapts.
Clinical trials are the engine of progress. Without patients willing to participate, the science simply halts.
But, and I have to temper my own excitement here, the sources are also very grounded in reality.
We have to be realistic.
Despite these incredible sci-fi advancements in treatment, significant challenges remain. The primary challenge being the exact one we started with, the sheer complexity of the disease and the lack of early detection.
This raises an important question, and it represents the central tension of the entire movement. Are we actually winning?
Right. With the fierce advocacy, the personalized legacy ribbons, the fundraising walks, the targeted sniper rifle therapies, are we actually getting closer to finally stripping ovarian cancer of its silent killer title?
We are fighting a war on two fronts, and we are currently only winning on one.
Oof. Okay. Explain that.
The treatment outcomes for patients, particularly those who recur or have advanced disease, are steadily improving thanks to these new therapies. We can extend life and improve the quality of that life far better than we could 20 years ago.
The sniper rifles are working.
They are. But the other front,
The screening front.
the other front is early detection. And that is where we are still struggling immensely. We can have the most advanced precision-engineered therapies in the world. But if the cancer is consistently caught at stage 3 or stage 4, because there is no reliable, non-invasive screening test, the mortality rates will remain stubbornly high.
The fire is still too big by the time the fire trucks arrive.
That's exactly it. We need a better smoke detector.
So the ultimate future focus has to be on finding that screening method.
Yes. Developing an effective routine screening method, perhaps a highly sensitive blood test that looks for circulating tumor DNA, or advanced AI-assisted imaging that can spot microscopic changes in the fallopian tubes without all those false positives that is the Holy Grail.
And until we find that grail,
Until we have that, early detection relies entirely on symptom awareness, patient advocacy, and the educational power of the Teal Ribbon.
it is a massive, multifaceted fight. It requires the scientists in the labs, the doctors in the clinics, the survivors sharing their maps, and the grieving families turning their loss into loud, unavoidable legacies.
It takes everyone.
Let's bring this deep dive full circle for you listening. We have covered an immense amount of ground today.
We started in the dark, looking at the biological stealth of this disease.
Yeah, that terrifying internal geography.
We explored how the spacious geography of the pelvic cavity allows tumors to grow in the ovaries, fallopian tubes, and peritoneum completely undetected because we lack a standardized, reliable smoke detector.
We talked about the terrifying subtlety of the symptoms. We unpacked the mechanics of why things like ascites cause bloating and premature fullness, and why nerve compression causes back pain.
And we established the golden rule.
Right, the golden rule. Pay attention to the persistence of those symptoms. If they last for more than a few weeks, that is your alarm bell.
We also dug into the systemic barriers. Recognizing a symptom is only half the battle. Navigating the economic toll roads, cultural taboos, and the threat of medical gaslighting requires immense support.
And through it all, we examined the incredible power of the Teal Ribbon. It acts as a beacon of community and practical resilience for survivors enduring grueling treatments.
It's an anchor.
And crucially, through resources like the funeral program site, it serves as a customized, personalized memorial. It turns profound grief into lasting advocacy, transforming a simple piece of fabric into a targeted weapon for public health education.
The journey from silence to awareness is long, and the science is still catching up. But every single voice added to the chorus makes a tangible difference.
It really does. I want to leave you with a final thought to mull over today, something that builds directly on everything we've just unpacked.
I'd love to hear it.
Imagine one of those personalized teal ribbons handed out at a memorial service. Imagine the gold lettering, the specific name, the dates of a life cut short.
A physical manifestation of legacy.
Now imagine that single ribbon pinned to a coat, carried out into the world. Imagine it sparks a conversation at a coffee shop or catches the eye of a stranger on a subway. If that one ribbon causes just one person to suddenly recognize a subtle, persistent pattern of bloating and pelvic pain in their own body, and if that realization empowers them to walk into a clinic, demand an ultrasound, and catch the disease while it is still just a whisper,
then the legacy of the one has actively saved the life of the other.
how many unseen lives has the simple act of memorialization already saved? Thank you so much for joining us on this crucial deep dive here on the Funeral Channel Network. Please listen to your bodies.
Absolutely.
Do not accept silence when you know something is wrong. Advocate fiercely for yourselves, advocate for the women in your lives, and keep seeking the deeper story. Stay curious, everyone.